Well, hello everyone. Today I'm honored to be with a friend and mentor of mine, Dr. Eric Greenleaf. Dr. Greenleaf is an exceptional therapist and author, and I'm really excited to talk with him today. He was a direct student of one of my heroes, Milton Erickson, and actually was the first to win the Milton Erickson Award of Scientific Excellence for writing in hypnosis. Dr. Greenleaf is also the author of The Problem of Evil, um, Ancient Dilemmas in Modern Therapy. And he's presently the director of the Milton H. Erickson Institute of the Bay Area, which is located in Northern California, an institute I'm proud to be a member of. So, Eric, thanks so much for talking with me today.
Always a pleasure, Paul.
Oh, great.
What shall we talk about?
Well, you've been at this a while, and I think at least 40 years. So I thought we could talk a little bit about a lot of the things that you have seen over the years that have made an impact on the way you do therapy. And I'll just say, I ran into you at the last or the one before last evolution of psychotherapy, which was great. And then I noticed you sat in all the sessions you could sit in and soaked up as much. And I was very impressed, certainly with someone with your background, and as long as you've been at it, the desire to continue to learn. So I'm very impressed by that, and something that I'm trying to emulate as well. So just to start with, what are some things that have stuck out to you over the years of experience and training with these remarkable people that you've been fortunate to work with?
Yeah, the main thing I guess is that I see and hear from famous therapists uh, over and over the same two things. The first being that to do therapy of any sort, you have to be like yourself, which means you have to do things in the way that makes sense to you in order to have the most impact with someone else. Not a question of hitting the strokes right, as in tennis, but of having your own feeling for the game. And that gives you your best chance of having an impact in the relationship, which Scott Miller and other smart people note is the instrument of therapy. It's not the therapist and it's not the technique. It's the therapist and patient in colloquy, agony, delight, or whatever happens, as in other important things like being a parent or a spouse or a friend. So that's one thing. The other thing is something that Jay Haley said, which may have seemed counter to his character as a kind of ironic, inventive, iconoclastic man. He was asked by a student of his, what would you teach therapists? Haley said, I would teach them to love their patients. If you love your patient, anything is possible. Well, both these things are what Milton Erickson said and practiced. The thing I noted in my brief time studying with Erickson was what a loving presence he had. He was slick and funny and disabled and very brave as a person, I think. And around him, people would cry and laugh and hug him and tell him their secrets. And the impression of the person was of a very loving and very close presence, even if he didn't know you. So that's what I think I learned in 50 years of doing different aspects of therapy. And the other important thing for the way I practice is that I am metaphorical and imagistic, both by preference and because I think it's the way people think. It's very hard to speak English without using pictures.
Yeah. Were you always like that when you started, or is that due to the influence of Erickson or others?
Well, I was always like that. I started out in uh, teaching a course in dreams, but not in interpretive gestures about dreams or translations of dreams, but I was teaching acting upon the dreams, either interacting with the dream situation or uh, more simply carrying the action of the dream forward in imagination. I later came to find by reading a little bit of neuroscience that what you imagine as you're sleeping or as you're thinking or daydreaming or fantasizing is mirrored in the exact progression of neural transmission in your body. And so that, you see your dog going like this and running in a dream, or you may be lying there snoring and imagining you're flying, your muscles are moving in small. This was brought home to me by as many things. I guess another important thing in practice is to learn from the expertise of your patients rather than to insist on your expertise about them. So I'm lucky in that I admire competence of all kinds. And I'll ask people to tell me or show me what they do well. And by the way they tell me, I'll know how they like to do things well. And that's the model for the therapy for that person. I've known many courageous people as patients. And one that I always cite is a patient of mine named Karen, who was blinded by a tumor of the brain when she was in her 20s. And before that, she had been a champion kid skier. And she and her friends would ski and she'd compete, and she was a great athlete. And after she was blinded, she took work as a legal secretary. She married well to a man who fell in love with her voice on the telephone. And we did a lot of hypnotic work together because she had various troubles and problems, physical and otherwise. It's a woman with a lot of good and bad fortune. She was once abducted by a boyfriend. Built a whole community of loving friends. Quite remarkable and very straight up nice person. And she decided in her 30s to become a competitive skier again. So she took up blind skiing, which is done behind a sighted guide, but at very high levels of athleticism, downhill slalom, the whole business, going through gates, handling ice and moguls. And you have to do that by sensing the guide. And I asked her once, because she lived where in the Bay Area, and we're about 4 hours at best from the snow. How do you practice? Because she had come fifth in the world in blind skiing.
Wow.
And she said, I practice in my dreams. When I sleep and dream, I run the course, the slalom or the giant slalom, and I handle the moguls and the glare ice and go through the gates. And as I practice, my body practices the sequence of motion I'll have to make.
Wow.
She decided when she was in her 40s that she wanted to learn to fly on the trapeze and did so. So if you ask me how I learned to do therapy, it's by listening slowly to people's description of competency and by listening in a compressed way to their description of the origins of their problems.
Well, I'll tell you, Karen has suddenly made me feel pretty wimpy.
Hey, me too.
Well, you know, as you're saying that, Eric, I'm just struck with the thought of how much of that in with another therapist who maybe have been trained to be more structured or goal oriented or focused on too specific of an outcome that you would not even talk about those things. You know, my friend Rob McNeely talks about it's important that therapists and clients are allowed to drift a little bit. And he said if they don't drift or allowed to drift, very little this wonderful I forgot how he put it, but this opening of opportunities to find, like you're saying, these competencies, these things. Uh, could you speak to a little bit about that drifting?
I guess I could. I like to cite what an artist said about that. De Kooning, I think it was, said, I don't like being upright. I like to be slipping a little bit. Because when I'm slipping, I can get a different glimpse of things.
Mm.
He said, I'm always slipping into that glimpse. I guess I'm just a slipping glimpser. He was classically trained in art.
Mm-hmm.
And he very idiosyncratically developed a different palette and use of figuration and like Erickson and like Matisse when he was older, he didn't give up his art. De Kooning had dementia, and he kept painting. But instead of these covered dense canvases, he would have marks that an art critic could identify as de Kooning and blank spaces of canvas. So I think there's something to letting your imagination or intuition or your feeling function, as the Jungians would say, guide you in your interaction. The first time I heard of Erickson was when I was in graduate school, and a sister student of mine came up to me and said, I hear you're interested in hypnosis. Here, read this. And I stood there and read an article by Erickson, and I put it down and I said out loud, oh, that's how you do therapy. I don't know what the article was. I sometimes go into trance reading Erickson's work. I can't get through it. But I think I took heart from it that you could do almost anything if it's well-intentioned and very attentive to the other person, their dignity, their way of doing things, and their pain.
Mhm.
And you didn't have to be checking your brain for method.
Right.
So,
Yeah. Yeah, in your book, The Problem of Evil, some of the cases, I found the book to be very poetic in how things are delivered, which, it's obviously you're a gifted writer, but there's that element of interpersonal poetry that permeates a lot of those interactions. Now, is this due to, like you said, just being able to open things and drift as we were talking about, or do you think so much of this is also your personality to where you're more just naturally prone to, engage in this kind of interaction, poetic interaction?
oh yeah, absolutely. I was a poet from a fairly early age. I mean, actually writing poems. And I like language, so my therapy is very wordy. But I also, I conceive of what I'm doing as in the line of people working with the other person's unconscious. And I like the way Douglas Flemons, another friend and colleague of ours, puts it, that in doing hypnosis, you are of one mind with the other person, or I conceive of it as kind of walking with the other person through their unconscious. And in that mind or way of experiencing, more dreamlike, more imagistic, more aphoristic, and less organized like an essay.
Mhm. Right.
The,
Kind of like,
the best CBT therapist I know, Michael Tompkins,
mhm,
is also a writer.
mhm, yeah.
And for a brief while, he was an actor also.
Mm,
So his interactions with people are present and accounted for, and his language is poetic, as you would say. He makes a good impression as a person, pays attention well, and he's quiet. So for him, giving somebody a workbook is different from if I did it. It wouldn't make sense from me. I
mhm,
don't talk or think that way. He was trained as a scientist,
mm,
and a guy we both admire, Rob McNeely, a physician.
mhm,
And whether it's he or Pat McCarthy, different physicians doing hypnosis, each doing it his own way and very determined, this is the way you can do it. If you're more like Pat, you'd be a physician sort of diagnosing and treating. And if you were more like Rob, you'd be very comfortable and original,
mhm,
just as a way of relating.
mhm.
And friendly, very warm. So when you work, you're more like Paul Leslie than like Eric Greenleaf, and that's why you're good.
Well, I won't, since we're recording, I won't debate you on
But,
that part. Well, it sounds like essentially your poetry, therapeutic poetry, it's like poetry with a purpose. So
yes,
you have the goal, but it's not so, it's not like reading a newspaper article where the goal is to give you certain information, like the headline and here's the information. There's a purpose to get the information, but there's this poetic purpose to flowing to get it rather than kind of, as you said, structured.
Yes, and that the language of the poetry ideally is the other person's language, not mine.
Right. Oh, yes, yes.
Because it's much easier if I if I talk with Rob about in the with the cadences and ways he talks, and with the same kind of expressions of warmth and ordinariness that he exemplifies.
Mm-hmm. Yeah.
If he were a patient of mine,
Yeah.
and so, you know, the simplest way of doing that is to take a phrase or a tone or a cadence or an image from somebody else and just repeat it back to them.
Mm-hmm.
And then embellish it. So it's very much like another thing I think very useful for therapists, improv theater training.
Yes, yes.
Because you have to accept an offer, no matter how eccentric it seems,
Mm-hmm.
or how little you feel competent to discuss the topic or take the part. But there are many good instances in therapy of set aside Freud's reluctance to relate intimately with people and his designation of relationship in therapy as transference or countertransference, and just say that things like, let me talk to you like a father would.
Mm-hmm.
Or if I were your girlfriend, I might say, and you can get easy with those transforms, even without studying Gestalt therapy, which trades in those kinds of things. Talk to your father in the chair. What would he say to you? Or if you were the dream, what would you say? Kind of thing. What are you trying to tell the guy? But that you could take up the role that the other person offers you. Erickson would do that a lot. My wife was reading some things he did with alcoholics. And, you know, the hard-bitten alcoholic who has Norwegian ancestors like Dr. Erickson would come in and sort of, you can't make me and I won't do it. And
Mm-hmm.
Erickson would tell him, you know, there are 3 bars between here and home. Stop with each one. At each one, buy 3 beers. And as you down each one, say, God damn you, Erickson. And then the guy would, you know, bridle and not do it.
Mm-hmm.
Stopped drinking for a while, then got back off the wagon, called Erickson again, said, I'm coming to see you. And Erickson said, bring a full bottle and we'll get drunk together. The guy wouldn't do it, so he stopped drinking again. That kind of just fun and courage. Erickson didn't feel that if you responded badly to him, you were resistant. Mm-hmm. He just figured he'd have to, was accepted in the terms of theater, accepting a different offer. You know, how was your vacation on Mars, Joe? And then you're stuck. You had a Martian vacation. You got to make it up.
Yeah.
So,
when you're supervising
yeah.
or teaching or training, how do you instill that in people?
Well, I try to identify what they do well as people. Same thing as with patients. And if they're slow, thoughtful people, I want to encourage them, listen slowly, absorb the feeling. I was supervising someone this morning who's actively religious in an ancient Christian tradition, but a very modern woman in business and so on. And she was seeing patients and had a depressed guy, and she talked with him about the loss of the feeling of God and asked if she could pray with him. And for the patient and for her, it was perfect, authentic, and very effective.
Mhm.
So a way to talk about the mysteries of life and death without being a bully about it.
Mhm.
You
Yes.
should think that's way, or what do you mean? So that would be a way I try to supervise. I want to, it's a little like coaching a team in sports. You'd like to know what the kid does well, and then find the position that magnifies that, makes it fun.
Mhm.
If you put somebody out of position as a patient or a therapist, they don't know what to do and they don't look so good.
Right.
And they don't have a good time in the game either, or in the conversation. So I don't like, or I do like to try to hit that person, and I collect, as you noted in the evolution conference, I like to see people work
Mhm.
or talk about their work, because I can get a sense of it. And, you know, when it comes to therapists, whether you follow Rogers, Carl, or Mister,
Hmm.
you can be a very good therapist if you happen to be like those men. A lot of people, whether they call it this or not, are very dramatic, the great therapists. I include Carl Rogers,
Mhm.
because if you see him, he's a very forceful, very directive guy masquerading as a,
Right.
you know, a very agreeable receiver of information. He's not like that at all. He selects them and he directs.
Mhm.
Sue Johnson, who's got a wonderful homespun manner she comes by honestly. She grew up in a pub.
Mhm.
It's the pub keeper's daughter.
Mhm.
Her mom ran the place. She says, I try to put, and she has an elaborate theoretical premise. She said, I like to put couples under the tent of trance when I'm working. And if you read those kinds of things as I do, or listen for them, you'll hear a lot of people speaking like Ericksonian hypnotherapists,
Mhm.
but calling there, it's like fried chicken franchises. They have a different brand and a different publicity. But who's the Burns? I've seen Burns, who's a CBT
Oh,
therapist,
David Burns. Yeah.
David Burns,
Yeah.
in a demonstration or a film or something. He was doing family constellations work,
Right.
essentially.
Yeah. Yeah.
But he doesn't call it that. So,
Yeah. It's funny you said that, because at the last evolution that I was there, he
yeah,
did something and I called him. I said, you were doing this thing from strategic therapy. And he's like, oh, was I? And
wasn't yeah.
it's just, that's what he just did. It just wasn't thinking about it. He just kind of on the spot just did it.
And Bessel van der Kolk, who starts as a psychiatrist and a researcher, and then has the enormous courage to sit through awful true stories. I mean,
Yeah,
horrifying,
terrible.
haunting. Uh, I admire him so much for being able to stay in the room and listen and feel those things. Comes out recently as part of a symposium on psychedelic aided psychotherapy. So you never know I think really good therapists don't look the same from patient to patient
Right.
and shouldn't. You know, you can, if you're a guy with a bunch of kids, you probably play with each one differently.
Mhm.
And, you know, they're your genetic issue and they grow up with you, but they're all different.
Mhm.
So it's like that. It's the delightful expression of human difference and its encouragement and coaching or direction. And suddenly things don't seem so difficult or daunting. That's a lot of therapy, I think. You
Mhm.
say, well, if you really want to do this, here's a way to do it using what you already know. That's why Erickson would say your unconscious knows more than you do. Or you say to someone, well, you know how to do this already. You just don't know that you know it. You'd say that to a kid, right?
Mhm.
You'll do great in the interview. You just don't know it's your first college interview. Break a leg.
Mhm. Yeah. Uh, you said something just a little while back I wanted to loop back to,
Yeah,
which is
sure.
your love of language.
Yeah.
And for me, that's also a big thing. I've been honored to be working in a special program lately where we're training therapists who will be working with veterans
Oh,
and to basically how to do hypnosis. And my thing that I always put in is like language. You know, the language is so important, and not just hypnotically, but just how we phrase things. We call it like the presuppositional language, all of that. Since you're naturally interested in language, what advice would you have to someone who's never, as crazy as this is, in a field that is based primarily on language, who's never really studied language and how language works? What kind of advice would you have for them? Because unfortunately, there's a lot of them out there. So,
well, again, the simple to say and artful to do advice is use the language of your patient. If you have people who've been in combat and you haven't, as I haven't, it's very hard to speak with them.
mhm,
They don't want to, and they're not wrong. Because how could I possibly understand losing a buddy under fire or any of the awful things that people do and witness and suffer? So I would ask for a description. I'd say I don't really, I think it's useful for therapists to display ignorance and say, I don't really know anything about being a man in combat. In fact, during Vietnam, I had a student deferral and I was grateful. And I only know from friends who went to war how horrifying it is. I would do that. And then say, tell me what you can about what you saw or did. And then once they did, I'd have it. I could put them back in it and be there with them.
mhm, yeah,
In some way, either metaphoric or with emotional contact.
right,
For example, I had a, a, a safe and loved childhood. I wasn't traumatized. I wasn't incested or beaten or any of that stuff. But big surprise, lots of people have been. So I want to be able to say, if someone tells me about being incested, how angry I feel that people would treat kids that way. Because I can't say, boy, I know exactly how you feel. This happened to me too. I can do that about major surgery and other things, disappointments in love. I'm there, I got it. But being abused as a kid? No, and it's a very important distinction. And for all male therapists or female, you have to work with the opposite gender or people with different sexual or behavioral interests than you. You have to ask them what it's like, and they can't really tell you. Because I can't say, oh yeah, I know that. I went to war when I was 18. No, I have to talk about friends who told me things. And that's perfectly good too.
Mhm.
So another thing I do a lot, and I recommend it, but you have to know what you're doing. I tell lots of stories, true stories. And I tell stories about myself that are true. And when they're accurate and helpful, they're very effective. If they're not, it's a bad mistake. But I'm quite happy to tell directed stories about myself, again, as a way of compressing a problem statement.
Mhm. Right.
And sort of saying, oh yeah, me too. You know, if you said you would your body got banged up in athletics, I could just say, well, me too. I played tennis, and
Right.
but if I hadn't, like with musicians, I don't play, I can't sing. I sort of admire it from a distance, and I can use vocabulary that they know that I don't really know. So I speak their language.
Yeah.
And I pick it up with phrases and anecdotes that they tell me. So me, and it's not true of everybody, I don't listen diagnostically. I listen rhetorically. I'm listening to the
Right.
story. And even if I can't remember your name, I will remember your dream or your story.
Mhm.
And
Right.
once you start to tell it, I'll know. And then it sounds like I understand you, even though I don't know what I'm talking about.
Mm.
It seems to be okay.
Yeah. And again, that's that poetry. Again, the poetry of the dialogue, because they're providing their poetry to us, and they have a purpose, and it's just getting out of our own heads and joining.
Yeah, I think it's that, Paul. It's relating in a way that feels intimate and but not intimate in a wrong way or a bad way.
Right.
Erickson said once, he said, I've heard a lot about this transference business, and I want my therapist to like me and like me immensely, but I want them to like me so that in a way such that I, as a therapist, can be pleased.
Hmm.
And so he would diffuse or shift romantic transference, or he'd utilize it.
Mm-hmm.
And I have an example of that that I wrote about, called Conjoined Therapy with an Imagined Co-Therapist,
Right.
about a patient who was in love with me as she had been in love with each of her therapists.
Right. Yeah.
But instead of describing it to her in the other language, I asked her to send me love letters. And she said she did it until she exhausted it. So, sometimes that stuff works, though. You can direct without really having time to think it through.
Mm-hmm. Right. Right.
And then see what's happening. And I think Erickson did a lot of that. He didn't, for a while at the beginning of his career, he would write everything out laboriously, including trances and articles. But later on, he said, he made some analogy that reminded me of diamond cutting. Why not go right to the stroke that makes something beautiful if you can?
Mhm.
So he became maybe less complicated as his artistry increased.
Mhm. Yeah. Well, Dr. Eric Greenleaf, this has been a lot of things to digest, but again, I'm just struck by the poetry. Every time I hear you talk or we get to chat, there's a flow that is always insightful. I'm always learning, but there's a comfort there, and I can see why you're still at it 50 years. I don't know if I would have admitted that I've been at it 50 years because then, I might be old then. I'm not saying you are, but so just
Well, you could say I am, and I'm still at it. So, as you love, Paul. But it's delightful speaking with you always.
oh, well, thank you. And I appreciate you talking with me.
You bet. Take care.
All right.